For more on the delivery of the vaccines, let's bring in the Executive Director of Primary Healthcare, Dr. Faisal Shuaib, who joins us live from Abuja. Dr. Shuaib, we're just hearing that some 32 COVID-19 Delta variant cases have been confirmed in 5 states. Talk to us about the pace of vaccination in Nigeria. With these 4 million Moderna vaccines that are being brought in, we probably will just be adding some more 2 million Nigerians to the list of our fully vaccinated people. How relevant is this pace at the wake of a third wave and the spread of the Delta variant?
Yeah, thank you very much. The 4,080,000 doses of Moderna vaccines that we've just received will be utilized as fast as possible with an interval of 4 weeks between the first and the second doses of the Moderna vaccine. But beyond these 4,080,000 doses that we've just received, we're expecting another 3.9 million doses of the Pfizer vaccine in August. We're expecting about 3.5 million doses of Oxford AstraZeneca vaccine again in the month of August. Then in September, we expect to begin to get delivery of the almost 30 million doses of the Johnson & Johnson vaccine. So in the course of the next few months, we're going to be getting over 42 million doses of COVID-19 vaccines that will go a long way in providing protection against COVID-19 disease.
Even with the 42 billion, we are still looking at a region of 21 million Nigerians out of an estimated 200 million. How relevant is that number when we look at the third wave and the Delta variant that we're now reporting?
So in actual fact, the 30 million doses of the J&J vaccine will be covering up to 30 million Nigerians, right? So when you add up the other vaccines that will have given to Nigerians, you will be approaching close to 50 million Nigerians, that will be vaccinated potentially before the end of this year, if we really are able to get all the vaccines that have been promised. But we have to also be mindful of the fact that these vaccines are being brought in through a facility that Nigeria has signed up to. Nigeria will be paying for the 30 million Johnson & Johnson vaccines. And we believe that we also have to be able to pace the administration of these vaccines. We never said that we're going to be able to vaccinate all Nigerians within 6 months or a year for that matter. If you look at what is happening in other countries, we believe that we'll be able to cover the close to 70% of the eligible Nigerians within a period of 2 years, so that we'll be able to attain herd immunity. If we continue at this pace, we believe that we'll be able to achieve herd immunity, especially knowing that in the course of the next few months, because of increases in production from the different factories, and the fact that those countries that have overstocked on their vaccines, the vaccine nationalism that we've seen in the last few months is now beginning to get dissipated, because countries such as the US, European countries are now have now been able to vaccinate most of their population. So they are now beginning to let go of those vaccines that they hoarded in the last few months. So those vaccines will be coming to Nigeria and other developing countries. So access to these vaccines will become more possible.
Indeed, Dr. Shuaib. What appears to baffle many Nigerians now is the way and manner we're told that the virus mutates. So there's what they call the Delta variant, and there are many who have had the full jab of the AstraZeneca are not even sure whether they are totally covered. And particularly when we are now told that whether or not you've had the vaccines, now you still have to wear your face masks.
Right. So what the vaccine provides, and this is what data has shown, this is what the evidence is that these vaccines provide protection against severe disease, hospitalization, and death. So it is possible that after you've taken the 2 doses of your vaccine, there's breakthrough infection, and you may have milder symptoms, but there is the clear evidence that the vaccine protects against mortality from COVID-19. Also, these vaccines, whether it's AstraZeneca or the Moderna vaccines, what data is showing us is that the AstraZeneca vaccine is able to prevent infection in up to 92% of cases when it comes to the Delta variant, and somewhere between 74 to 95% protection against the Delta variant is what the Moderna vaccine protects against. So we're in a good place when it comes to the vaccines that we've selected. They will be able to protect against the dreaded Delta variant. And we believe that in the course of the next few months, people will begin to see that most of the infections that we will see in Nigeria will be among those people who have not been vaccinated. Already in Lagos, we're seeing that most people who are now hospitalized are people who have not been vaccinated. So this is really a golden opportunity for Nigerians to come out and be vaccinated once we roll out the next phase of the vaccination.
So what you're saying is that the fact that you're fully vaccinated doesn't mean that you still will not interact with the virus. It's just that you wouldn't get to the point where you're hospitalized, and then the chances of fatality is very low. Did I get that quite well?
Absolutely. That is what the evidence is showing. The evidence is showing that, yes, there is some protection, but even after you've gotten the 2 doses, you have to wait for at least 14 days after these 2 doses before you can say you have gotten protection from the vaccine, right? And then if you do fall sick, this illness is more likely to be very mild compared to if you've not gotten the vaccine at all. So all across the world, what we're saying is that the vaccine protects against severe disease and deaths. So deaths from COVID-19 are now deaths among those who have been unvaccinated with the vaccine.
I see that there seemed to be some disparity between the figure of Nigerians who took the first jab and those who've had the complete doses. What do you think is responsible for this?
Yes, so there are people who have been given the first dose and they came forward and took their second doses at the right time, at the times that were communicated, in the media. However, some people took their first doses, and before it was time for them to take their second doses, we ran out of vaccines. But help is now here. In the next couple of days, we're expecting to get additional AstraZeneca vaccines from the United Kingdom, and those will be targeted at giving those people who have taken the first dose their second doses. But even apart from the doses that we're expecting in the next couple of days, around mid-August, we have been communicated that we'll be getting an additional 3.5 million doses of Oxford AstraZeneca. So those people who have taken the first dose will definitely get the second doses, and then those who have a preference for AstraZeneca over Moderna, for example, can still get their first and their second doses.
I get you very well, Doctor. Thank you for talking to us. Now we have to wait to see when, for instance, I haven't had the jab yet, but you're saying that everyone should get one in the next 2 years, right?
Absolutely. But the earlier you get it, the better.
Okay, but it depends on whether I make it to the list of those who are considered this time.
So as it were, we've now opened up the vaccination to every Nigerian who is 18 years and above. So as we roll out the vaccination program, please try and get registered on the NPHCDA website so that you will choose your location and your timing for the vaccination in terms of scheduling. But as long as you are 18 years and above, you are eligible to be vaccinated, and you'll be scheduled to get your vaccination in a health facility of your choice.
Dr. Faisal Shuaib, Executive Director of Primary Healthcare, thank you so much for talking to us tonight.
Thank you for having me.